Hi, sir.
Hello.
So we have a subscriber who's asking us that she has existing metal fillings done many years back. She wants to know, is it safe to leave them like that, or does it require a change? What's your take?
Okay. Uh, First, thank you for the question. So it's a common question asked for many people because all the previous filling done many years ago were all silver amalgam fillings. So mostly when people got silver amalgam fillings, like I can show you an X-ray here, where you can see on all the first molar, you've got huge silver amalgam fillings. So typically we are seeing a patient who's now about in her late 30s, but these tooth must have erupted when the patient was about 6 years old, and the silver amalgam fillings were done very early in her life. So all these silver amalgam fillings are more than 25 years old silver amalgam filling. So usually when people come to us asking for whether is it safe for the silver amalgam fillings to be left in the mouth, what needs to be done, what we usually do is two things we do. Of course, we examine the patients clinically, check what is the integrity of the silver amalgam filling is, and also take an X-ray to see whether any decay is there under the filling or how the roots of the tooth are, if there are any signs of infection below the root surface. So these are the two things first we check. So clinically when we check, many of the silver amalgam fillings can, not only the filling but the adjacent tooth structure can exhibit wear and tear, because if you see it, it's a very huge filling, and so there can be some small wear and tear on the filling that can happen, especially after 15 years, 20 years of service. Some wear and tear of the tooth structure as well as the silver filling can happen. So only if there is wear and tear of those silver fillings are there, and if the tooth is otherwise intact, there are no signs of infection in the tooth, usually we say the patient it is safe to leave the silver fillings, it is not required to change them. Of course, what we also do is if there are minor wear and tear which can be repaired, we can use either a composite or a cement-like material to repair those wear and tear. So it will act as a binding and prevent any new decay happening at those places where wear has happened. But for some reason, say the silver filling, most of the silver filling has come off or it's broken down, in many instances, it might not be possible to do another tooth colored filling there. The reason being, usually these fillings are very wide. It covers almost the entire tooth structure, right? So most of the tooth structure has already been damaged by decay. Two, all the silver fillings can also corrode over a period of time in the mouth. These corrosion products can also occlude the spaces, the tubules which are called the retinal tubules inside the tooth, and eventually these fillings might invariably lead to getting a root canal done and a crown done. So unless otherwise there is a problem, we don't suggest removal of the fillings, because if a removal of filling is necessary, then mostly it can end up with either a full coverage crown alone or a root canal and a full coverage crown, as the case may be. But for cosmetic reasons, we usually don't suggest removal of silver filling. One, because when you remove the silver filling, it's a mercury filling, you will have mercury vapors, and it's unnecessary to take the entire filling out and then do it. Of course, for cosmetic reason, if somebody is insisting, we take all due precautions to reduce the mercury vapors. We can take those silver fillings and then do composites. Hope you like this video. If there are any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye and thank you.
வீடியோ பிடிச்சிருக்கா லைக் பட்டன் கிளிக் பண்ணுங்க, சப்ஸ்கிரைப் பண்ணுங்க, பெல் ஐகான் கிளிக் பண்ணுங்க. இந்த மாதிரி வீடியோஸ் உங்களுக்கு வரும். தேங்க்யூ.